This is a case of acute appendicitis. We are doing laparoscopic appendicectomy. We are holding umbilical tube with the lens tissue holding faucet, taking a stab incision supraumbilical area. I will put a Verresclose needle and rub it on the rectus sheath. And after rubbing it on the rectus sheath, I will lift it and I will enter into the peritoneal cavity. I will hear 2 click sounds and there is a free movement of the tip in the peritoneal cavity. There are other tests also, that is a teardrop test, aspiration and pressure test. We are not performing that. We are doing, there is a free movement into the peritoneal cavity. While starting the CO2 inflation, we have to check there is a equal distension of the peritoneal cavity in all quadrants of the abdomen. See, abdominal cavity is distending equally in all the quadrants. If it is distending in one quadrant or it is a doubtful, we might be in the preperitoneal space or in the subperitoneal space. If we see a distension in one quadrant of the abdomen, we might be into the bowel. That has to be confirmed by a free movement of the tip of the Verresclose needle all around in the peritoneal cavity, because abdominal wall will act as a fulcrum and tip and this body of the Verresclose needle will move on that fulcrum. That is a good test to see the patient's Verresclose needle into the abdominal cavity. See, we can hear the loss of dullness into the abdominal cavity. You can hear a resonant sound because air is filled into the peritoneal cavity. We have to check the flow rate of which is set on the machine, CO2 insufflator machine. We also have to check the pressure. We have set a 14 set pressure and we have to match that pressure with the actual pressure. Once it is matched with the actual pressure, show me the machine. This is the CO2 insufflator machine. Set pressure, set flow rate is 5 and set pressure is 14. Once this set pressure matches with the actual pressure, we will remove this Verresclose needle and we will insert a trocar. Now the pressure is 14, so that our pressure is matching with the set pressure. We will insert a safety trocar. We have to hold the trocar like this in your hand, in the palm. Okay, place it on the palm, just hold it. This finger acts as a safety finger, or which protects the abdominal organs from injuring the. Again, I have to hold with the lance tissue holding thing with rotatory action and constant pressure. I have to enter into the peritoneal cavity. Once we are in the peritoneal cavity, we can see a free flow of CO2 from the peritoneal cavity, and this confirms that we are into the peritoneal cavity. Once our trocar is in, we will enter into the peritoneal cavity and confirm that we are into the peritoneal cavity. Right.